Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal health care provider.
Welcome to Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. I am your host. My name is Hope, and today I have joining me Victoria.
Hi there. I'm also on the marketing team here at Tanner Clinic, and I'm happy to be talking with these lovely ladies today.
Today, our guests are our beautiful and wonderful diabetes educators. I'm going to give them the opportunity to tell us a little bit about themselves and how they got into this field. So go ahead.
My name is Cindy Johnston. I'm a registered nurse. I've been a nurse for a lot of years. For most of those years, I have been a diabetes educator, 21 years now. I decided to go into teaching after working on the floors for a long time, thinking it'd be a great way to accent my career. I came to Tanner Clinic 6 years ago and said, you folks need a diabetes education program here. And they agreed. That was nice.
My name's Gina Carling. I am also a registered nurse, and I have been a diabetes educator for a little over 10 years. So I think we have a combined 30 plus years. I actually became a diabetes educator. This is a funny story. I was a nurse on the floor at a hospital where Cindy worked, and she called me up one day and said, Gina, do you want to be a diabetes educator? And I said, I don't know. Do I want to be a diabetes educator? And she said, you absolutely do. And I said, well, I really love my nursing job. Can I stay working on the floor? And she said, you can do whatever you want to. You can do a little of both. And I think it was maybe 1 week, and I quit my nursing job or quit working on the floor and became a diabetes educator with Cindy. And
it's great stuff.
She's taught me everything I know.
That's cool. I didn't know you guys had worked together before.
Yes.
So you have a history.
I know who to choose.
So I wanted to know, what are some common misconceptions about diabetes that you hear all the time?
Okay, most people, I think, would like to hear that diabetes will go away. And it actually doesn't. So when a person has diabetes type 1, type 2, they can be under control, but it doesn't go away.
There is no cure, yes. And I think a common misconception is they think that they got diabetes from eating too much sugar or drinking too much soda. And that can contribute to it, but there's a huge genetic, lifestyle, lots of variables that go into whether or not a person gets diabetes. And
Gotcha.
so that's another misconception, I think.
I feel like I've thought both of those things probably. So
Yeah, same. I'm definitely
I'm going to learn a lot.
definitely chugging down a Dr. Pepper going, oh, you know what? This probably isn't the best thing for me to do right now.
Probably not.
I first want to start off talking about a little bit about what diabetes is. So I was hoping that you guys could shed some light on, one, what diabetes is, and two, how someone goes about getting diagnosed for diabetes.
Well, diabetes is an autoimmune disease, and it is very genetic, and it can be also environmental as well. But for the most part, as we look at people that get diabetes, it is passed down literally more from genetics. It is type 2 is insulin resistance, and actually all adults have some insulin resistance. People with diabetes, of course, have more, and people with type 1 have where they have actually no insulin production at all. So then they have to take insulin by injection.
How it's diagnosed is mainly done by a blood test. When you're pregnant, it's diagnosed. Gestational diabetes is diagnosed through a glucose tolerance test. But the main way that diabetes is diagnosed is through a blood test, and it's called a hemoglobin A1C test. And they do a sample of your blood, and they test and see how much glucose is stuck to hemoglobin cells. And it's in a percentage, and a percentage of 6.5% or higher is a diagnosis of diabetes, and a percentage of 5.7 to 6.4 is a diagnosis of pre-diabetes, which millions and millions of people have.
And we will be talking about that.
Yes, we have some questions.
We have some questions for sure on that.
So, speaking of prediabetes, what are some symptoms of prediabetes or diabetes that might be experienced?
So lots of times there are no symptoms, and that's one of the things about especially prediabetes is you don't have any symptoms, and it just progresses very, very slowly. But one of some very common symptoms of diabetes or higher blood sugars are blurry vision is one that's very common, thirst, drinking a lot of water, urinating a lot. Can we say urinating?
This is a medical podcast. You can say whatever you want.
And you're just really, really tired. But everybody is tired nowadays. So it's a hard one. It's lots of times it's very hard to diagnose or self-diagnose.
The thing that drives people to the doctor most often is the excess thirst and excess urination. They wonder what's going on. And thank goodness they do.
Right. Just like the other day, I was talking to Hope about how thirsty I've been lately, and I've just been craving like oranges and grapefruit a lot. And she goes, Victoria, it's the winter time. You probably just need to get out in the sun more often. You probably don't have
Or like you have scurvy or something, or you need more fresh fruits. So it could be any number of things. It could be scurvy
or diabetes.
Or diabetes. There's really no in between.
But I was going to say is sometimes it is the eye doctor or a urologist that diagnoses diabetes because the only complaint they have is I'm urinating a lot, something must be wrong, and they go in and it's the urologist or a doctor that diagnoses them with diabetes.
And that would be them ordering that test for the A1C?
No, they actually find it in their urine.
Oh, okay.
A urologist would find it in their urine.
Okay.
Oh.
And then they say, you have diabetes, you need to go see your doctor.
Ooh. You need to go see a diabetes educator and learn how to manage it.
It's the only way.
I know that you said that there sometimes are hidden symptoms for diabetes and prediabetes, but are there things that people may come in for thinking that they have diabetes, but it's not necessarily? Like, are there similar symptoms that mimic diabetes and prediabetes, and it's actually something else?
I think it's more the opposite. I think they don't know that they have diabetes and they go in like the things that we talked about. They're extra thirsty, they're urinating a lot, their vision has become blurry, they have numbness and tingling in their feet. Those are common symptoms, but they don't really know that they have diabetes. They just think something's wrong.
And for people like me, so I do have an autoimmune disease and I get a lot of those symptoms, but we'll talk about later how we have done some testing with you guys.
Yeah.
And I know for a fact I don't have diabetes, but I may have some other things going on.
If someone has hypoglycemia, in other words, low blood sugar, that can be the same thing as they drop low as the symptoms of a stroke.
Oh, wow.
So sometimes that gets confused.
Really?
Yeah.
Yes, that's true.
So it might not be a stroke, but maybe just in case.
If you're lucky it's not. Exactly.
Do like hypo and hyperglycemia kind of go hand in hand with diabetes, or are they just totally separate blood sugar related issues in the body?
I think lots of times hypoglycemia is a precursor to
It is.
Okay.
diabetes.
Leads to it many times. We've seen many a patient
Yeah.
with a history of hypo. Yep.
We know the differences between types of diabetes, but how do you go about treating each of the different types of diabetes? Is it similar? Is it different?
When a person's diagnosed with type 1 diabetes, it's usually the symptoms come on very quickly. And sometimes they're hospitalized. Usually they're children. But we see type 1, in any age. But they need insulin, and they need insulin right off the bat. If it's type 2, many times they'll have symptoms after they've actually had diabetes for quite a while. And it just depends on how high their blood sugars are as to what they need. So they usually will need oral medication, sometimes insulin, but all of them need to have the same exact things in diet and exercise. We teach all of those things so that they are aware of lifestyle.
Eating healthier, being more active. Those are huge ways to treat all kinds of diabetes.
Yeah.
So what's the benefit of coming to see somebody like you who is certified in diabetic education? versus a generalist?
Well, that's all we do all day, every day is diabetes. And we have insight into the latest and greatest technologies, the insulin pumps, the continuous glucose monitors to help monitor them. We go beyond just the basics of diet, which is super important, but we also can teach them everything about their medications that they're on. And we do that, talk about the benefits and side effects of all of the medications that their providers have prescribed.
And we have the time, and we take time with them. The providers don't have that kind of time. They need to see their next patient right off, and we spend up to 2 hours with a patient many times, sometimes a little more if they need it. But for the most part, we have a curriculum, and the curriculum is guided by the American Diabetes Association. And so we have just everything we need right there. And we give a lot of handouts so people can take things home and read them, because they do get a lot of information when they come.
It's like drinking through a fire hose.
Oh, yes. A lot of information all at once, I bet, especially if it's a new diagnosis. And it often is. Like, it's not
I'm sure
always...
it's very overwhelming, too, to have to change your lifestyle to manage it. And
yeah.
so...
And we're very accessible to them because we know it is overwhelming and can be overwhelming at first. And so we are very accessible to them, that they can reach out to us. They've called us on the weekends before... evenings, whatever. We try to be accessible and helpful, because at first it is super overwhelming when you get that diagnosis. It's not always going to be like that, but there's a lot at first for it.
I'm sure too, especially if you're a parent and your child is experiencing type 1 diabetes, and if you don't have a super family.
It's already hard enough to be a parent.
Right? And then to have something like that kind of come crashing into your life and trying to figure out what you can do to keep your child healthy. Or if you're pregnant and you get gestational diabetes, like you're already, dealing with growing a baby. And now on top of that, you have to try and figure out how to keep yourself healthy throughout that. So.
And it is very important too. So we make sure that they get every bit of information that they need.
So do they come and see you once or multiple times?
Depends on
just a person.
Depends on the needs of the patient.
Yeah. We assess that when they come.
Okay.
To make a treatment plan for them.
And they decide, and sometimes they say, I need to come see you. And sometimes it's 6 months later that they come back to see us. And sometimes it's a week and 2 weeks. It's just totally the needs of them, what they need.
So I actually am curious to know what can happen if someone doesn't get their diabetes treated, or like they don't find out about it soon enough. You said type 1 diabetes can lead to hospitalization. Hospitalization, that's a hard word, apparently, for me. But do you have any extreme cases of patients that have not had their diabetes?
Lots of extreme cases, and I think that's something that we talk about at the very first, is you don't have any complications now. We want to keep it that way.
Yeah.
But the complications for high blood sugars are vascular in nature. And we want to keep those vessels strong and healthy and pliable. And over time, when you have high blood sugars, your vessels do not stay that way. You start to get vascular damage.
Yep.
So
the number one complication of diabetes is actually heart attack. Heart attack and stroke, and about 52% of the people that have heart attacks have diabetes. And not all of them know that until they have their blood test done with the heart attack. And they find out, double whammy, you've had a heart attack and you have diabetes. So that happens a lot.
I know there's like a lot of limb losses too and that sort of thing if diabetes isn't managed properly. Is that because the blood vessels just die in the feet and that
the
sort
little
of thing?
tiny vessels are affected first. And that's why so many people have the problems with their vision, their kidneys, and then especially that neuropathy in their hands and feet. And sometimes the complications with the amputations in the toes and things like that.
And so the blood flow becomes less and less, but most of them will have actually a sore that won't heal. And so then that leads to amputation, but not as much anymore as it ever used to. People do worry about amputation a lot, though. That's the number one worry a lot of times when we ask them, what's your biggest concern? Oh, I want to keep my limbs. Okay, well, that's good. That comes after.
Well, then keep coming to us and manage it properly.
That's right.
I had a lady from the hospital who had her toe amputated, and then they sent her. And when I sent her over to us for diabetes education. And when I started talking to her about the complications over time, what happens, she started to cry. And she said, I've had diabetes for 20 years. Why didn't anyone tell me? She said, I knew I had high blood sugar, but I was going to knitting group. I was going to all my grandkids' soccer games. I was doing all the things. Why didn't anyone tell me what was happening inside me to those vessels? And I think that is an important thing that we do, because they don't. I mean, lots of times they're diagnosed and they just are told, don't eat sugar. And that's all.
Yeah, but I mean, what's sugar? I mean,
Yes.
like when Hope and I and a couple of other people on our marketing team did a trial with you, we did get those continuous glucose monitors. One of the other ladies on our team has a family history of diabetes, and like her, a direct relative has it. So I think it was good for us to learn, even as people who aren't necessarily fully diagnosed as diabetic, just to know what the different things are that do it, to spike your blood sugar and that sort of thing. Like, everybody always tells you don't eat sugar. Well, what is sugar? Carbohydrates technically are sugar, but they're not evil. Like, you do still need carbs in your diet and fats and proteins, but learning how to eat things in the correct order to make your blood sugar stay level was really cool to see.
I was going to say, I think the education that I got just from wearing that for 10 days and then talking with you, I did learn that I am pre-diabetic, but it was more, I was eating maybe at the wrong times or the wrong things at the wrong times.
Right.
And so it was like, instead of eating a cookie or a piece of cake, you want to eat something that is not full of sugar, so that your body can actually...
Or not
do
even
what
that, but it was also, if you're going to have crackers, have some cheese with it. Have something that has some protein with it, so that your blood sugar stays kind of level. And then it was cool because you guys were like, oh, go not buck wild with it, but you were like, try out different things, experiment, see how like a bowl of cereal in the morning will do that. And here I am thinking that if I eat like, I don't know, Special K, it doesn't have as much sugar as, say, like Lucky Charms, right? So I'm thinking, okay, if I eat that, it should be fine. But that is just a straight up carb. And I know the milk has some protein in it, but not a ton. So
Are we sponsored by Special K and Lucky Charms?
These are not sponsored. And I'm not trying to bash any companies. Just put that in there as a disclaimer.
But
I just
Lucky
really
Charms
like Lucky
are
Charms.
the highest carb cereal there is. Just
Is
so
that
you know.
true? I didn't know that.
I didn't know that.
There are little marshmallowy things in there.
That's why they're so good, because sugar is addictive.
Maybe it's Captain Crunch. One of those two. Anyway.
They are also fortified with vitamins, though.
Yeah.
I would just like to add that vitamins are also in it.
And whole grains.
They are taking
In
them off-
moderation.
They are
But-
taking them off the list of healthy foods. Did you know that? All cereals, they're taking them off the list.
But yeah, even as somebody who doesn't have prediabetes, it was cool to see the different types of foods that affect it, and drinks and that sort of thing. Like, I had like a full sugar soda, and then the next day I had a diet soda or a zero sugar soda, and seeing that it didn't affect the blood sugar level at all was really interesting to see.
Eye-opening.
And I know I have family members that have diabetes, and I always was curious as a kid, why do they drink diet soda? Like, it tastes so bad. But I realized that that's what they need to do to keep their levels at the same rate. But speaking of those things, what kind of tools can diabetic educators use to help their patients monitor their diabetes? Is it medication? Is it those continuous glucose monitors? Is it pricking your finger? Like, what kind of things do you use to help?
All of that.
All of the above.
Yep.
The 4 ways to manage diabetes are diet, exercise, medications, and monitoring. Those are the 4 cornerstones.
Right. And that's what we base all of our education on, is the 4 main things of care for your diabetes. There's more things to that, for sure, but we do that the most. We talk about that the
And
most.
monitoring is super important, whether it is pricking your finger with it using a glucometer or the newer continuous glucose monitors, which we absolutely love and which you guys got the opportunity to try. And we do Almost on every patient, we put a continuous glucose monitor on them, just to let them experience what you guys experienced.
It's an eye-opener. We've had patients really comment on that when they come back and say, I had no idea, how this would affect. Now they do. People will react different to different foods, so it's good to know.
That was very eye-opening for me. I think one of the major things I took from that, too, was for me is like the portion sizes, too.
Oh, yeah.
Because you told me about someone that you knew that had made like a healthy meal, but they had just eaten way too much of it so that their blood sugar spiked. And I feel like just being an American and living in this country, like we know our portion sizes are insane. And it's not about necessarily restricting so much of the foods. It's just how much of each you're eating and eating it in moderation, which
I think we say there's nothing you can't eat. It's just how much you're eating of it and what you're combining with it and how often you're eating
like chicken, rice, and a veggie is a very, quote, healthy meal. But if you have like your plate is mostly rice and it's white rice, right? That's what you guys were saying, that you could see that would spike blood sugar levels. And they have a protein with it, that chicken, but the rice is just so full of those carbs that's what would spike.
And it could.
So one of the things that I'm loving about this is hearing you say all that you said.
Yeah, and
because it makes me feel really good that you remembered all this.
Yeah, I learned
that
all
our
that.
teaching was effective.
And it's been a few months since we went and did that continuous glucose monitor thing, but it was so cool to see
really
those.
was.
And I feel like I've made some diet changes since. Like the other day, I really wanted to have watermelon, but I know you guys mentioned that that's one of the higher sugar fruits. So I made sure that I had like my actual lunch before I had my fruit. And then I did not feel that spike in blood sugar.
It's a difference.
So it's really interesting to see.
Yeah.
And I think a lot of people can benefit from that. So do they keep their continuous glucose monitors on forever when they come and see you? Is it just
Very
dependent on
good
insurance or something?
There's a whole bunch of continuous glucose monitors out on the market. We absolutely love all of them. It doesn't matter which one you use. But usually the trial we get is just a short period of time, 10 days to 2 weeks. And then it depends on their provider writing a prescription, whether or not, and their insurance coverage. Sometimes people just pay out of pocket and they will just wear it intermittently throughout the year. We have lots of patients that do that if their insurance doesn't cover it. And it is quite affordable that way, actually. Lots of insurances and more insurances are covering continuous glucose monitor.
Which is wise for them to do. It's very, very easy for people to stop monitoring their blood sugar with the finger sticks. And then they have no idea where they're at until they're really high, and then they figure it out. And the next thing you know, they're in trouble.
So we've talked a little bit about how we found out about, how I found out about my prediabetes diagnosis. But for the people listening and watching, can you just explain what prediabetes is?
Prediabetes is if you want to get a diagnosis of it, it's an hemoglobin A1C of 5.7 to 6.4. And lots of times you have no idea that you have prediabetes, but there are ways, and really it's just a warning. It's a warning that you're starting to have insulin resistance, but it's not enough to cause complications. And that's the important thing to remember. It's kind of like a yellow light. The yellow light, you're not in the red danger zone yet.
There's two types of people in this world. Those that go through yellow lights and those that stop at them.
Yes, prediabetes is a great warning thing for people if they're diagnosed at the right time. The problem is there's millions of people walking around with prediabetes that have no idea they have it. And if they don't make some changes, diet, exercise, etc., they will become diabetic. The reason why we say that people that have diabetes and they have it forever is because the amount of insulin resistance it takes for a person to go over the A1C of 6.5. Once you're there, your body has that much insulin resistance. Even if you do great things and you go under 6.5, that doesn't mean it goes away. But with prediabetes, yes, it does, because the numbers are just enough to say you don't have as much insulin resistance. So if you do a few things and reverse it, you can reverse it all the way. Does that mean you can go back to the lifestyle you were living with, whatever you're doing before? No, you can't. You got to stay vigilant in your diet and so forth. People recognize that and do very well.
Yeah.
Which is one of the best things about learning about diabetes is it's actually a great way to live a healthy lifestyle that you may not have ever heard of before if you hadn't been diagnosed.
Yeah.
So if you flip it around and look at it as a good thing, not a bad thing, there are some very good things that come out of being diagnosed with diabetes, pre-diabetes as well. Yep.
And even our moms that have gestational diabetes, which goes away after pregnancy in almost every case, they're all really upset and sad when they come to see us. And we just say, you know what, this is what you have. It's just extra insulin resistance while you're pregnant. But it's actually a blessing that you came here because you're going to learn these life skills that will help you yourself, hopefully preventing getting type 2 later in life, but also with your family. Just a healthy lifestyle of being more active and eating more whole and natural and healthier foods.
Yeah.
How long does it typically take somebody to find their pre-diabetes diagnosis and then eat and exercise in order to get rid of it? Does it take weeks, months? Like how long?
It can
It's
vary.
very individual, just like everything in life. It's very individual. Some people, sometimes all they do is stop drinking Coke.
Yeah.
We're not sponsored. But
Sugar and
sometimes,
soda.
yeah, sometimes it's just they take soda out of
Sugared
their life.
cola.
Sometimes they start an exercise program and just eat smaller portions, or they don't have a dessert every day. Everyone is individual, and sometimes it takes a long time, but sometimes it's quick depending on
3
lifestyle
months.
changes that they make.
Right.
Yeah.
So is it something like I know that these GLP-1 injectors are super hot topic lately. They are used to treat diabetes. Is that also beneficial for somebody who's pre-diabetic to be on, especially if they're overweight and looking to lose weight? Or what do you feel as diabetic educators about it?
Well, the American Diabetes Association does recommend that if you are diagnosed with prediabetes, that you're on metformin. They don't have a recommendation for GLP-1s, but common sense would say, yeah, it's probably a good idea.
That's helpful to hear.
Because we just did that.
We just did a podcast about weight loss, and a big topic right now with weight loss is the GLP-1.
Like the Ozempics out
Yes, and we talked about that and a little bit about diabetes and things like that. But it's good to hear from a diabetes educator too that not only is it beneficial for weight loss, but for someone who is experiencing pre-diabetes, it's something helpful that they can do as well.
You mentioned the word we're diabetes educators, but I think that's the important thing with a GLP-1 or metformin or any diagnosis that you get, any medication that you take, is to be educated on it. Find out what are the benefits, what are the side effects. Don't just blatantly start something that's recommended to you per se, but
especially if you're taking other medications, like how do they interact and that sort of thing. So
And we teach all of that.
that's great.
Yep.
yeah.
Do you guys have anything else that you want our listeners to know about diabetes, pre-diabetes, gestational diabetes, anything like that?
Well, I think when you look at it as a huge picture, there's a fair amount of things that people absolutely don't know. And one of the things that they do that is the worst they can do is turn to the internet. There's so many false things on the internet. So many, eat this food, it'll cure it, on and on and on. So be informed. It's most important that you find out everything that you can possibly find out that is correct. And that's why you come for diabetes education.
Go to the right source.
Yep, exactly.
Especially because it's different for each person, too. Right. I think on the internet recently, one of my favorite misconceptions I read was that if you drink green tea multiple times a day, now not knocking green tea, I love it, tastes great, but I saw something that said it will make you lose weight and it's nature's Ozempic. I was like, that's not true. Like, there is no such thing as a nature's.
People are always trying to find that hack or that thing that magic.
But there's no hack to your health. You just need to speak with providers and people that are subject experts like yourselves in that. So,
And I would just say in closing that Cindy and I are absolutely passionate about diabetes education. We love our jobs. We love being able to help people, and that's what we do all day, every day at our job.
We do feel like we go the extra mile
Yeah.
for people.
I definitely see that from you guys, especially saying, some patients need 2 hours and we're willing to take that time with them. I feel like that's a big comfort to people.
Yeah.
I just want to thank you guys so much for coming and educating us a little bit more on diabetes and managing it and pre-diabetes and getting ahead of that. I would recommend anyone who has diabetes and wants to manage it better and understand it better, and someone who may be concerned with their risk for diabetes or pre-diabetes, I think it is so worth your time to make an appointment with one of these two ladies and really learn more about what is happening with your body and learn how to better take care of it. And they will take as long as you need. From what we've heard, they will take as long as you need to help you understand and manage it. So I highly recommend calling our appointment line and making an appointment if that's something that you're interested in. And thanks again for coming on.
Thank you.
Guys.
If you have any burning questions about what is normal or maybe not normal, be sure to keep following us on social media, and we frequently post things to our Instagram story asking for your burning questions for different health topics. So be sure to follow, and you can continue to see content like this.